Welcome back to Central Health Talks on KZI FM 88.7. I'm Anastasia Sims with Central Health, and I'm joined by Leslie Gudarzi, Clinical Nutrition Education Program Manager at Central Health. Before the break, we were discussing the social determinants of health that lead to obesity, like lack of food access, stress, and historic racism. We also touched on BMI and some of its limitations. So the first line of treatment for obesity is diet, lifestyle modification, behavioral therapy, and regular physical activity. Before choosing a diet plan, Leslie, what are some red flags to look out for?
Yes, there's several red flags to watch out for when looking at a diet plan or a nutrition pattern or way of eating. First of all, if some diet promotes limiting or restricting foods or food groups. For example, you're not allowed to have carbs, you're not allowed to have bread, you're not allowed to have fruit. That should raise a red flag. Also, labeling foods, quote, good or bad. Foods should not be good or bad, they're just simply food, and there are no good or bad foods. Also, eating less than 1,200 calories per day. We know that it's not possible to get all of the vitamins and minerals that you need if you are not consuming at least 1,200 calories a day. Plus, it's going to lead to a great deal of actual physiological hunger, and you're more likely to overeat at the next meal or when you stop that eating pattern. We also know that if a program requires you to purchase special products, supplements, or packaged foods, that these are also red flags. That is not sustainable, and supplements are not regulated at all by the FDA and should be avoided, particularly for weight loss. It also should be administered under the supervision of a licensed dietitian, and many people that promote weight loss programs are not licensed by the state of Texas. It also is expensive or cost prohibitive. So, for example, some diets require the person to eat a lot of a certain food group, and in these economic times could be very much cost prohibitive.
Okay, so let's talk about the keto diet. You explained in your red flags that a diet that says no carbs or just meat is a red flag. So talk to me about keto.
Yes, the keto diet was actually developed in the early 1900s at Johns Hopkins University in order to prevent seizures in pediatric patients, and is noted to still be used for this purpose. However, it is a medically supervised provision that diet is promoted and done in a hospitalized type of system. Wow. Our keto diet is not the same as the Johns Hopkins diet in popular culture. Instead, it really focuses on eating meat and limiting carbohydrates. One of the things about the keto diet that is just not sustainable is in these economic times, it's very difficult for someone to eat meat 21 meals a week. That's just not cost effective.
So you talked about one con. Tell me some more pros and cons of the keto diet.
Some other cons of the keto diet is that generally if you eat a slice of bread or if you eat some carbohydrate, it would pull you out of ketosis and is no longer effective. Wow. So just having a blip on the scale is going to kind of counteract the entire diet itself. Another problem with a keto diet is that it's deficient in the B vitamins. There are 8 of those, and vitamin C if you're really following it. And generally people that are deficient in B vitamins will feel tired and lethargic, which no one wants to do on top of being restrictive with their food intake. So that's a recipe also for grumpiness.
Okay, another diet that I've heard of is intermittent fasting.
Yes, intermittent fasting, again, like the keto diet, is a blast from the past and was developed early in the early 1900s and has made a resurgence. And basically in intermittent fasting, it means that we're going to restrict calories either through the hours of the day or the number of days in the week. For example, this could mean that someone restricts what they eat and they only eat between the hours of 8 and 4 during 8 hours of the day. Part of the problem with this is if you ask me to go out for dinner tonight, I'm going to have to say, sorry, we need to go at 3:30 in order to make that work, or I would not be following the diet plan. The other way that it can be utilized is by eating 75%, let's say Monday through Friday, of your caloric needs, and then on the weekend, Saturday and Sunday, eating 125%, so you eat a little bit more of those calorie needs.
That sounds like there's a lot of pros and cons with this one. Can you tell us more?
Yes, some pros and cons. Part of the pros with this is that it does show a slight statistical positive impact as far as weight loss goes. We see about a 6% weight loss with in compared to just diet only control of about 5.3% in an evidence-based study. So that's one of the pros. One of the cons is it doesn't really, again, allow for life to happen other than on the weekends. So I really would have to be kind of calorie restricted. So if I go out to dinner or have a business engagement or something comes up, such as a vacation, it really doesn't allow for those types of things. It's not sustainable.
Okay, what about the Mediterranean diet?
The Mediterranean diet has some evidence-based statistics that show that people that follow this tend to have lower cardiovascular risk and tend to live longer, healthier lives. It is made up of a lot of fresh fruits and vegetables, lots of fish, whole grains, and even moderate alcohol. So, and it also emphasizes physical activity. Some of the pros of it, obviously, are that we have less disease risk, but some of the cons are sometimes, again, we don't have that availability to those fresh fruits and vegetables or fish in certain areas of our towns and cities. So we have to keep that in mind.
So out of the 3 diets that we have discussed, are these really practical?
I think when we look at diets from the 1970s onward, in our society, they have not traditionally worked. We have gotten fatter, body fat percentage-wise. Our BMI, even with the restrictions of that, have gotten higher, and our waist circumference has also increased. So the simple statistics is diets simply don't work. Behavior change and modifications to our environments really should be emphasized.
So what are some practical recommendations that our listeners can use to maintain a healthy lifestyle?
One important thing is to look at yourself as an individual, assess your BMI, your waist to hip ratio, your medical history, your biochemical markers, and your nutrition and exercise habits.
So for someone like me that has a higher BMI but low blood pressure and low cholesterol, how should I measure my health?
You would look at BMI simply as one of those factors. And if all of those factors are trending in the same direction, that's a good indication. But not to hang your hat on it, so to speak. It's not a tell-all type of parameter. It is used commonly in medicine, so I can't ignore it or say just simply don't look at it, but look at those other factors in addition to. And if all of those other factors are within normal limits, then put BMI at the back of the shelf and don't worry about it.
Okay. What about the goal for weight loss?
The goal for weight loss to be medically significant is actually 10% in 6 months. So, for example, if I weigh 200 pounds and I'm on a weight loss journey, I know I need to lose weight based on my assessment, a good goal would be to lose 20 pounds in 6 months, which is going to end up being 1 to 2 pounds per week. So this is slow and steady. And when I say medically significant, that means that we see decreases in blood pressure, we see decreases in our blood lipid panels, and decreased risk of disease states.
Okay, what about our caloric intake?
Caloric intake should never go below 1,200 calories, like I said. And even shows like The Biggest Loser have shown that when people put their caloric content way too low, it actually damages their metabolism. It actually damages their metabolism, and they will actually need less calories and lose lean body mass. So that is not recommended to go below 1,200 calories.
And sleep.
Sleep is very important. I recommend that you get 7 to 9 hours of sleep per night. This is super important in order for your blood pressure to have a chance to go down, for your brain to reset, for your stress levels to be under control, and to recharge your body.
So, any other recommendations for weight management?
Other recommendations I have, really to encourage lifestyle changes instead of dieting. Reward those healthy behaviors, not weight loss. So, for example, you should be exercising 5 days a week. Get a non-food reward. Like, for example, I'm going to treat myself to a new book, or I'm going to treat myself to a trip somewhere or something, or a new pair of tennis shoes or whatever, as a non-food reward, but for doing those healthy behaviors. The healthy behaviors will pay off, and the proof will be on your waistline. Some other things that are recommended to do, besides the things that we've already talked about, is also making sure that you eat 3 to 4 meals per day at regularly scheduled intervals, so that your blood sugar is able to stay at a constant, stable level, and then also to make sure that you're not overly hungry and avoid overeating later in the day. Another good practical recommendation is to avoid nocturnal or nighttime eating. A lot of people do crescendo dieting, and what I mean by that is crescendo means starting off really soft and getting loud, and we tend to do this with our eating. We tend to eat really, really small breakfast, we tend to eat a moderate lunch, and then we tend to just go all out at night. We eat a large dinner, and then we follow that up with large snacking. And we really don't do any physical activity, so our calorie intake and expenditure are really mismatched, which can lead to excessive intakes and weight gain.
For someone that lives in one of the food deserts that you were describing earlier, what would be some practical recommendations for them?
Some practical recommendations are to choose foods that are very nutrient dense and have a lot of fiber to help feel full and also stay healthy. So things like whole grain rice, beans and legumes, nuts are also really good choices, and then seasonal fresh fruits and vegetables. For example, oranges and apples. Those are in season currently and are economically not as expensive as some of the other fruits and vegetables.
So, and easier to find if they're in season.
Absolutely.
So Central Health has a weight management study. Talk to me about that.
Central Health is offering a weight loss management study at Community Care beginning in August 2022, and it will go through the middle of November to measure weight-related outcomes with medically supervised and evidence-based nutrition program. This program will give the participants access to weight management medications that are FDA approved. It will also provide individual and group counseling for our patients as well.
So what are some of the requirements for the program?
The requirements are that you have a BMI over 30, and it requires weigh-ins, measurements, and class attendance and individual attendance to the group, to the individual meetings, and to the doctor's appointments. The program also is available in both English and in Spanish.
Do you have to be a MAP patient?
Yes, you need to be a MAP or MAP basic patient to enroll in the study. If you would like more information, you can contact 512-978-8470, or you can contact me directly via email. My name is Leslie Gudarzi, and my email address is Leslie, Leslie, .Gudarzi, Goudarzi, @centralhealth.net.
So Leslie, before we wrap the show, do you have any final thoughts, any final recommendations for our listeners?
Yes. Focus on improved health instead of a specific size or weight, and don't get so caught up on society's expectations on your BMI or your weight. Be healthy.
Thank you for joining us on Central Health Talks on KAZI FM 88.7. You can continue the conversation with us on Twitter at Central Health TX or like us on Facebook at Central Health TX. Send us a direct message. I'm your host, Anastasia Sims. Thank you, Leslie, for joining us. If you or someone you know needs access to healthcare, you may call us at 512-978-8130 or visit centralhealth.net.